Hello and welcome to CDO Magazine interview series. My name is Andy Sajus and I'm the field CTO with Ahead. And we're partnering with CDO Magazine in a series of interviews with today's data and technology leaders. Today I have the pleasure of talking with Ram Kumar. He's the Chief Data Analytics Officer at CIGNA. Thanks for joining us, Ram.
Thank you very much, and thanks for the opportunity.
Absolutely. So Ram, tell us a little bit about yourself and your role at CIGNA.
Yep. All right. So I have more than 34 years of experience in the industry, of which about 29 years I've focused on all areas of technology, from starting my career as a programmer on the way to architect, program manager, change and transformation executive. Then I've been a CTO and CIO for the largest global insurance companies. And then I also have over 24 years of experience in data analytics, including various areas of data. And I started this journey somewhere in 1992, which such as data strategy, data governance, data ethics, data risk, data quality, master data, metadata, data monetization. And I started this work as a passion, actually. Even though I was a technologist, I always had a passion for data. And I have a strong background in AI and machine learning related R&D work, and have applied the R&D work to solve complex industry problems since from 1985 to 2005. During this period, I was very fortunate to work with some of the fathers and pioneers of this field of AI and machine learning as early as early 90s actually. And then I've held many senior and executive leadership roles, such as CTO, CIO, Chief Data Analytics Officer, and recently as a CEO of a number one data science and AI company, and globally in data and technologies. And I have worked with numerous teams and businesses in over 40 countries. And I'm really very fortunate and lucky to have had strong commercial experience and background in technology, digital data analytics, AI, and machine learning. And it's so great to see these fields are coming together in the present data-driven digital age as they are critical enablers for driving business strategy. That's my background in a nutshell, but I joined CIGNA only a year ago as the Chief Data and Analytics Officer for its International Markets Division, which covers over 30 countries in the Americas, Europe, Middle East, Africa, and Asia Pacific regions. And my responsibility is to build data analytics capabilities in these markets by working closely with technology, risk and compliance, and business partners to drive creation of data-driven culture and generate business value out of data across these markets. And what is very exciting about this role is the opportunity to work with different markets with varying business size, business priorities, diverse products and customers, and varying levels of maturity in data analytics, technology, and business processes. So from my experience, one size doesn't fit all and will never work in international markets for many reasons. Therefore, I have to ensure that I focus on the right business priorities that would create value, and at the same time uplift the capability in the markets in data analytics. It requires a thoughtful balancing act to be done and is therefore challenging, but that is where the opportunities are. And that's why it's always exciting for me to work in international markets. So that's my background.
So Ram, obviously you bring a lot of perspective with the global market. And I think specifically, let's think about the healthcare industry. The healthcare industry has met significant challenges over the past year and a half. How have you seen technology become a supporter of business goals in a way it may not have been before?
Yeah, that's a very good question, actually. I think I can give a bit more detailed answer to that. So if you ask me to name one positive thing to come out of the pandemic for organizations globally, it has definitely been the fact that organizations have expedited their digital agenda through technology. And a recent global survey revealed that in just few months, the COVID-19 crisis brought about years of change in the way companies in all sectors and regions do business. Companies have accelerated their digitization of their customer and supply chain interactions of their internal operations by 3 or 4 years. And the share of digital or digitally enabled products in the portfolio has accelerated by 7 years, which is amazing. And during the pandemic, consumers actually have moved dramatically towards online channels. Because of lockdowns, they have no other choice. And companies and industries have responded in turn. And the survey results confirm the rapid shift towards interacting with customers through digital channels. They also show that rates of adoption are years ahead of where they were pre-pandemic or when previous surveys were conducted, and even more in Asia than in other regions. Respondents are now 3 times more likely to say that at least 80% of their customer interactions are digital in nature compared to pre-pandemic. That's how the change has been at a rapid pace. So let's look at the healthcare industry. The healthcare industry is actually not an exception either to the unprecedented and accelerated digital strategy. Across the industry, people are now taking a more engaged approach to the healthcare cover and are keen to ensure that they have access to the best care should they need it. For example, last year, there was a whopping 600% in demand for virtual healthcare appointments. And we expect that this will form a core part of the healthcare journey for many patients, whopping 600%. The strong uptake in telehealth services demonstrates that people are becoming more receptive to using technology services to complement or supplement traditional face-to-face consultation. And it is likely this change in attitude will lead to people becoming more driven to seek out the details of the healthcare and to demand enhanced services such as personalized services tailored to their specific needs, and will definitely reject one-size-fits-all approach. As well as driving tighter penetration of private health insurance. This will also require health insurers to adapt their offerings to meet evolving customer expectations and needs. In the longer term, we at CIGNA are also looking at how we can drive continued innovation in our capabilities in these areas. To this end, we have invested in innovative functions and teams and dedicated resources to look at digital and how we integrate that across our value chain with the support of data analytics to create that intelligence and use it to improve our customer service and experience. So we have been investing in the last couple of years in strategic initiatives that enable us to leverage technology and data to improve our customer office. Such, for example, investment into a joint venture with Honeysuckle Health in Australia, which is a 100% data-driven health services company. Launch of a new health services business, Evernorth, which brings together a vast array of health services capabilities. And the recent acquisition of MD Live, the largest telehealth vendor in the US, which allows us to deliver services including urgent care, dermatology, therapy, and psychiatry via its network of certified clinicians. So we have taken these bold actions throughout the COVID-19 pandemic to make it easier and more affordable for our customers to access the care they need. So we are creating a differentiated and digital-first healthcare experience, one that leverages our expertise and innovative tools and resources and data to help our customers improve their health, well-being, and peace of mind. So done effectively, this opens up the potential to create highly personalized care pathways that reflect the patient's full health history and offer a 360-degree approach to the care management. Yeah.
Mm-hmm. Wow, that's impressive. I love hearing your guys' initiative around digital first. So from your perspective, obviously you bring a lot of in-depth around AI and leveraging AI with analytics. So as AI continues to deliver promise in this space, is CIGNA implementing AI and machine learning techniques to meet business goals?
Okay. Our number one strategic goal and priority is affordability of healthcare, which means ensuring that healthcare remains affordable and accessible for the people and communities we serve. This means we should lower the cost of care if we want to achieve affordability goals. To lower the cost of care, we are focused on improving how we deliver healthcare services effectively and efficiently to our customers, but at the same time ensuring we are at the forefront of the best pharmacy and medical trends in the industry. So we are doing this by creating innovative end-to-end solutions that meet the pressing healthcare needs. So to support the affordability goal, our solutions should also be predictable and simple for our customers to be comfortable and confident about our offerings and trust us. And therefore, it is critical that we apply data analytics coupled with AI and machine learning to drive intelligent automation, to create efficiency and effectiveness, and create intelligent data-driven digital solutions. So we apply AI and machine learning solutions to bring that intelligence across various healthcare domains, namely clinical, network, client, underwriting, claims, payment integrity, and also fraud, waste, and abuse, because the more we find savings, it contributes to affordability. For example, there are many examples we use AI and ML. I don't want to go into details. Let me give one example. So we use AI to leverage patient data from their visits to hospitals or clinics, both as inpatient or outpatient for treatments. And we look at the data to provide early predictions of the likelihood of patients suffering from chronic diseases. So our clinicians will then use that insight, will then proactively reach out to those identified patients with well-designed care management and care pathway management programs customized to that individual. In this way, we can not only help to protect the individual's future health, but also ensure cost savings for these patients.